Welcome back. It's mid-morning on WKYT. Nurse practitioners across the country are celebrating more than 50 years of practice. This is National Nurse Practitioner Week.
Dr. Julie Marfell, the Dean of Nursing at Frontier Nursing University, is here to tell us more about it. Thank you so much for coming in.
Oh, thank you very much for letting me be here.
And nurse practitioners play such an important role in healthcare delivery today, right? Maybe more than ever.
More than ever. You know, if you look at the residencies for medical students as opposed to nurse practitioners, we have increased 85% in the last probably 5 years in the number of nurse practitioners that we actually graduate, as opposed to about 11% for physicians. So we really are there to step in because the need continues. You know, we continue to need healthcare, and as a team with physicians, we can really expand our access and make sure everybody has what they need to be able to be taken care of.
Especially in a state like Kentucky, where we have, you know, some of those major medical facilities in one part of the state, but you have so much of the rest of the state that needs care.
You know, Frontier Nursing University is located in southeastern Kentucky. We're in Hayden, and I just spoke yesterday about the history of Mary Breckinridge, and we continue it today. Our mission is to produce nurse practitioners and nurse midwives to serve rural and underserved areas. And we're still going strong in Kentucky, especially down in the mountains. You know, we have 300 graduates in the mountains alone in Kentucky that are nurse practitioners.
What kind of care do nurse practitioners provide? There's that feeling of literally you have a nurse and you have someone with that extra set of knowledge, right?
That's exactly right. We're all educated as nurses, and then we go back and get a graduate degree. We can get a doctorate, we can get a master's, and you get not only prescriptions, you get not only a diagnosis, but you get the ability to talk to us and that we can talk to you. And one of the things that I think we do very well is we listen. We are trained to listen and to observe and really make it about the patient, because that's what's important. It's all about the patient's always in the center of everything that we do, because we know we can suggest to you that you do this or that, but if we don't ask you, can you do this? We've just wasted some time, because there's a lot of things that we say, oh, you need to do this, you need to do that, and you know, you need to go out and walk. Well, they don't live in a neighborhood where that's conducive. Or you need this prescription. Well, I can't afford it. There's something else that we can do. So being able to ask questions and listen is one of the things that we do very well.
And you hear all those vital services that you're providing. The career path to this. And what is this? I mean, do people need a background in medicine?
Oh, no, absolutely. We're nurses. You know, you need to be a registered nurse. We have the opportunity at Frontier to go in as an associate degree nurse or to go in as a bachelor's prepared nurse. And then you get a graduate degree, which is 2 years. And then you go on to get your doctorate, which is another year at Frontier.
Very good.
Julie, thank you, and happy Nurse Practitioners Week.
Well, thank you very much.
Absolutely.
We're celebrating all week.
And so good to know that Frontier University is continuing to grow and expand, and we look forward to talking more about that. Thanks for coming.
Well, thank you very much.